Hello, and welcome to the MAP Update Training for June 2016. The topic of this month's update training is Area Agency on Aging 1B services and other places to refer people to. The idea is that sometimes we receive callers who need assistance that have nothing to do with MAP services. So I wanted to provide you with the equipment and tools to know where to send people. And also to let you know a little bit about what AAA1B does. So we'll start first with the Area Agency on Aging 1B programs and services. The first thing that the Area Agency on Aging does is provide information and assistance. We typically don't necessarily think of this as a service, but this information and assistance is a very important service. The Area Agency on Aging 1B has a toll-free number, which is 800-852-7795. And this brings into our resource center at our Southfield office. Certified resource specialists answer the phone, and they can provide information and referrals to callers on many of the services in the community. So the great thing is that they know how some of these programs work. So if somebody has a question about subsidized housing or about nursing home care or about how to find a home health care company, our resource specialists know the ins and outs of programs in the community that can help, and they can help explain these programs. But then they can also tell them where to go. There might be a service that somebody doesn't know about, and so the resource specialist can help them, inform them about what might be available to them given their particular needs. So this is a great thing, and this is a great thing for you to use too. So if you have a caller or working with a client, it's really great to be able to know where to refer them and know that they're going to get some good answers. So if you have a client that needs information on housing or nursing home care or respite care or some other aging service, this is a place where you can absolutely refer people with confidence. Another program that the Area Agency on Aging 1B offers is the out-of-home respite program. So what the out-of-home respite program does is it helps give caregivers a break. And so this is available to caregivers living in the 6 counties that the Area Agency on Aging 1B serves. And so that would be Livingston, Macomb, Monroe, Oakland, St. Clair, and Washtenaw. Also, what this program does is in order to qualify for this program, the caregiver or the care recipient must be 6 years of age or older. So this program is funded by Older Americans Act dollars, which is for people who are 6 years or over, but either the caregiver or the person needing care has to be 6 years of older in order to partake in this program. So there's some flexibility there. The care recipient must require assistance with activities of daily living. So that would be, help with toileting or getting up and down out of a chair or walking or standing. And then they must also live in our 6-county region. This is designated for caregivers caring for a loved one 24/7 and who need an extended break. And people can get a reservation for up to 2 weeks at a time, twice a year. So this is really great if somebody wants on vacation or if they just need some time to themselves, or maybe, maybe the caregiver needs surgery and needs some time to recoup. So this is really a great thing that can happen. Now, this is done by cost share. So depending on the person's income, there might be a small cost for the out-of-home respite program. And then if people want to partake in the out-of-home respite program, they would just call the Area Agency on Aging 1B's toll-free phone number. Another program that the Area Agency on Aging 1B offers is the My Choice Medicaid Waiver Program. Medicaid covers a wide range of in-home service options. This is designed to allow a person to remain living in the community instead of a nursing home. In order to be eligible for this program, a person must be either 65 years of age or over the age of 18 and disabled. There is a medical eligibility criteria for this program. So a person has to be medically eligible for the nursing home. They go through the same screening process that a nursing home does. So the same questions that would qualify somebody for nursing home care would be like the same types of things that would qualify somebody for the My Choice Medicaid Waiver Program. And this would be needing help with activities of daily living or having a dementia diagnosis, which would make them it unsafe for them to live independently. So in addition to that medical eligibility criteria, there's also a financial criteria, and that is that the individual's income would be $2,199 a month or less. Now this is the individual, so if it's a married couple, they don't look at the couple's income, just the individual needing care. And the assets would be less than $2,000 for an individual. Now if they are married, they look at assets of both the spouse, but there's what's called spousal impoverishment guidelines. And basically there's a protected amount of assets up to $119,220 with a floor of $23,844. Now, when we've talked about Medicaid in the nursing home, we've kind of talked more about how to figure spousal impoverishment in the same way. So I'm not going to kind of go into that, but the point is that there's a certain amount of the assets that are protected for the community spouse. Now, with the My Choice program, it's usually at capacity, meaning that there might be a wait list for services. And this really varies depending on the geographic area in which somebody resides and, you know, what day it is. So this is a really great program for people who would like to stay at home, but need some services to help them do so. Another program that the Area Agency on Aging 1B offers is called the Community Living Program. And this program provides, has a professional provide an independent living consultation over the phone or in person with the older adult and or their family, and helps participants navigate the resources available in the community. So really what this program does is help somebody come up with a game plan for either caring somebody or for their own care. You know, and it can triage for different services, you know, help screen for maybe some benefits to which somebody might be entitled, help inform them about what other services might be available, and then, you know, kind of look at what informal support the person might need, and then talk to the person about what their wishes are, and really just kind of help come up with a game plan for that individual or family. This is for people who are age 60 or older, or a caregiver of somebody who's age 60 or over. And this is really for somebody who requires assistance with daily care needs. So, you know, somebody who's relatively healthy and can get, you know, not so much for them, but for somebody who's starting to need assistance or who really does need assistance. And then a person has to reside in the Area Agency on Aging 1B service area. Another service that we offer is the Access newsletter. This newsletter comes out quarterly and is a free newsletter. So it'll come out February, May, August, and November. Individuals can sign up to receive this in the mail simply by filling out the Access postcard, or they can call the Area Agency on Aging and ask to be put on the mailing list. This is also available online at our website. Another program that's covered under the Area Agency on Aging 1B is the Medicare Medicaid Assistance Program, which is us. We do have a separate phone number than the Area Agency on Aging. This phone number is geo-routed to the local agency that will serve somebody. So this, our toll-free number, if you're talking to somebody and they have a friend that lives maybe in Grand Rapids, you can just give them the MAP phone number and it will connect them to their local office. And our volunteers, right, this is kind of the work that we do. We help people with Medicare, Medicaid, and associated insurances. Yeah, so, so we know what we do, but it is under the umbrella of the Area Agency on Aging 1B, and it is something that the Area Agency on Aging 1B does promote. Another program of the Area Agency on Aging 1B is the My Ride 2 program. This is available in Oakland and Macomb County, and what this is it's a one-call, one-click mobility management service that's dedicated to helping seniors and adults with disabilities find transportation options. If you've ever been without a car, either because you've recently had surgery or are working with clients, that can't get around, you'll know that finding transportation in this area is really hard. There's some shuttles offered by the senior centers that might help take somebody to the grocery store or doctor's office, but those geographic boundaries are somewhat limited. The Smart Bus has a senior connector ride, but that doesn't go everywhere, and the timing of it might be a little bit difficult to navigate. And there's some other programs that also provide transportation, but it's really a difficult maze to navigate. So the My Ride 2 program has all those resources at their fingertips, and they can help meet somebody's needs in Oakland and Macomb County with transportation. It has a separate phone number and a separate website. So 855 My Ride 2 is the phone number, and if somebody calls, they speak with a transportation expert, and they help kind of connect them to the right resources. The Area Agency on Aging 1B also offers senior health and wellness programs. They do this by coordinating with different senior centers and volunteers. So the PATH program or Matter of Balance programs, these are programs that help educate people and tell them about different strategies to help manage their care. This is actually also another volunteer-based program. So the trainers for Matter of Balance and PATH are often volunteers who are trained to conduct these presentations. And these presentations are usually at our community partners, like different senior centers or hospital programs in the area. If you've ever bumped into somebody that has attended one of these programs, you will see how valuable these programs are. I have never heard a bad thing about something. In fact, people usually rave about these. So if if you're working with somebody that might be able to benefit from one of these, there's a complete list on the AAA1B website. You know, and so like matter of balance, we'll talk about fall prevention, past chronic disease self-management, you know, talks about different strategies to manage chronic disease. And so this might be diabetes or arthritis or, you know, there's some disease-specific presentations. Or how to deal with chronic pain, how to thrive and survive with cancer, enhance fitness, eat healthy, or moving better for better balance. These are all programs that are evidence-based, that are proven to be effective, and are given, you know, given to the community. So really, if you're working with somebody that might be could benefit, there's a list on our website. Also, if you wanted to be a part of this, you know, they're always looking for volunteer trainers. Some of you might have seen this in the news. The Area Agency on Aging 1B has a subsidiary called Same Address. This is a newer service, and this is a private pay service. The idea with Same Address is to keep somebody at their same address. And there's two primary services offered by Same Address. The first is a Senior Concierge service. Senior Concierge services provide daily living support. So if somebody you know, needs transportation or shopping or meal prep or housekeeping, or they want help running errands, this is something that can be done. Home modification and repair services, that could be a home safety assessment or installing grab bars or fixing something that might be broken around the house. And then professional services, and that includes estate planning, financial planning, legal assistance, taxes. The Senior Concierge service actually has like a button where somebody can actually just push the button, and a call is placed to the Same Address Senior Concierge service, and the person can just say what they want. You know, I'd like to go to the store, I'd like to go run errands, or I'd like, you know, my bathroom faucet's, you know, leaking. Whatever it is that they need, it's just a press of a button away. Same Address also offers in-home care solutions. So if somebody needs help in their home, so if they need help with personal care, getting dressed, skin care, oral care, social visits, respite, hairstyling, or healthcare management, you know, it'd be like care plan assessment, health advocate, where, you know, you can help them talk to their doctors or talk, you know, navigate billing issues, a health coach, medication management, or just monitoring the health status. These are also services available for purchase through Same Address. So those were the Area Agency on Aging 1B's services. Now, where can we refer people? Well, if you remember nothing else, you know, the Area Agency on Aging 1B is really a great place to refer anybody if you're not sure where to go. So if they need any senior services, you know, that could be like Meals on Wheels. Well, there's a different Meals on Wheels provider for each area. So, you know, instead of trying to figure out which is the right place to call, you can just send them over to AAA1B or in-home care or housing or whatever it is. You know, AAA1B is probably a really, really great place to refer many people. You know, but there's also other places that do the same thing. You know, there's different, you know, each county has a resource advocacy program. some of our MAP counselors are resource advocates, and so that's a great place to refer people as well. There's some programs, and some of the senior centers are really great as far as being able to know what's local in the area. So, this isn't necessarily a comprehensive list of where to refer people. It's just kind of like, in a nutshell, this is, a very simple list. If somebody is you think that somebody's being abused or exploited, you can refer to Adult Protective Services. So elder abuse is not just physical abuse. It can be neglect. So if somebody is being cared, has a caregiver, and that caregiver isn't feeding them or bathing them as they should, that's neglect. It can also be self-neglect. Sometimes we have clients that walk into the office that you just don't know if they're safe at home, maybe you've done a home visit, and there's some real things that are of concern. Maybe, the house is dirty, or, it's clear that that person might be eating expired food, or you can report for self-neglect too if you think that person is in danger. That might be a resource for you. This also includes financial exploitation. Financial exploitation is part of elder abuse. It's considered elder abuse. And it's actually the #1 form of elder abuse, is being financially exploited by somebody's own family members. So again, if you're talking to a client and it's clear that their adult children are misusing or exploiting that person financially, Adult Protective Services is a really great resource for you to know about. Sometimes through our MAP calls, we get people who are on Medicaid, but they're not MAP clients. So they don't have Medicare, that maybe that they're younger and they have a Healthy Michigan Medicaid plan, or they have, a different type of Medicaid, maybe the emergency-only Medicaid, or, even if they have a child, or maybe somebody through the CMH system, they need some Medicaid help, but it's beyond what we've been trained to do. Well, a great place to refer them is the Medicaid Consumer Hotline. If the person already has Medicaid, the Medicaid Consumer Hotline can help them answer their questions, and pull up their record, and figure out where to direct them. Sometimes when you're counseling a Medicare beneficiary, you might get questions about my child, or maybe somebody called us on accident. My child is through the Michigan Medicaid program, and it helps keep children insured. So this is for maybe kids that don't have any insurance and they need medical insurance, or maybe their parents don't have access to health insurance through their employer. This would be a great resource. And finally, Social Security benefits or lost Medicare card, you go to Social Security Administration for that. Now, this isn't by any stretch of the imagination all the resources available, not even a little bit. I just wanted to, talk about, in a nutshell, what maybe might be our most common places that we would refer to that have, aren't really within the realm of the MAP. So this is just a good jumping off point, but I'm sure, as you're thinking about it, there are probably, 100 different other options that, we can include on our list as well. And finally, I want to talk about calculating savings and shift tools. So when you go to ShipTools, shiptools.org/MI, and you go to that Clients tab and pull up a client contact form, you'll notice at the bottom, under Topics Discussed, there's an option for savings. Now, we're working on developing a tool to help better navigate this, but I just wanted to throw in just a quick mention of the savings portion. Even though there hasn't been any talk about savings, it's something that I've been working on behind the scenes for the last couple of years. So I try to derive something for savings based on, actuarial data. But what's more important is what the actual savings are. So now that we have a way to report savings, we should try to. And really, for right now, do the best you can. Start thinking about what you might have saved the client or consumer. For example, if you've helped switch somebody's drug plan, well, it's very easy to see the savings there. Or maybe you've helped somebody with a claim, and now they no longer owe a bill. Well, that would be a savings that, because of, some of your efforts, we've helped save somebody something. So it's not necessary that you verify that something's been completed. For example, if you've helped somebody with a Medicaid application, you're pretty confident that the person's going to get it, but you don't know for sure, that's okay. You can still report that as savings. Likewise, if you've helped somebody with an appeal or you've helped somebody with a billing issue, if it looks like something positive is going to happen and that person will save money, you can report that. It's not necessary by any stretch of the imagination that you have verified recouped funds, but rather it just demonstrates our value. What's really important about savings is when we talk to lawmakers about the import of the MAP program and the value that we have to taxpayers and Medicare beneficiaries, a great way to communicate our value is through how much we have saved older adults. Because when we save older adults money, that savings goes back into Michigan's economy. So I just wanted to put that bug in your ear, to let you know that it is important to note savings, and it is something that I look at, and I know that it's very important to the people that I work with to have that. And there's just some quick guidance on savings. So if you're working with somebody with Medicare Part D or a Medicare Advantage plan and you're switching plans, well, you can just take the difference between the old plan and the new plan, and that would be the savings. It's not necessarily that you enroll them, but if that person wants to enroll themselves, you can certainly report that as savings. Now, if somebody is not sure what they're going to do, or maybe doesn't want to switch plans, obviously you wouldn't report that. But if you're fairly certain that they're going to switch, you can report that as savings. Also, new to Medicare, there's a couple different ways you can report savings for people you counsel for new to Medicare. The first is ask them what they pay right now. Maybe they have an employer group health plan, or maybe they don't have any insurance. And you can ask them what they're paying now for their prescription drugs or health care. And sometimes they'll know off the top of their head because it's such, an outrageous number. We can take that difference between, you know, the current plan and then the future plan, and that would be the savings. Or another way to calculate savings for somebody who's new to Medicare is to take, you know, to figure out like the full cost of the drug for 12 months, and then take the difference between that and the future plan. And you would use the cost of today for the remainder of the year. So, you know, if you're counseling somebody today, their plan won't go into effect until July, and so the plan finder will just have those totals there. So in this slide, it's showing the example of somebody's switching plan. So at the top is somebody's current plan, and then that first health Part D is somebody's is the cheapest plan for them. So this column here is the estimated annual drug cost, and here you'll see cost as of today is $598. So with the first health Part D, under the estimated annual drug cost for the cost of today, it's $500. So if you subtract the two, it looks like this person will save $98 for the rest of this year by switching plans. And so it would be a $98 savings. Now, if we're looking for maybe somebody who's new to Medicare, and so maybe, you know, over here on the bottom is where you would find the full cost of the drug. So you calculate the full cost of the drug for the rest of the year and subtract that from the $499.80, and then that would be your savings. And if you know, in my notes, I did something wrong. I multiplied the full cost of the drug by 12 months. But really, I should have just done it for the rest of the year, so the remaining 6 months, and then calculated the savings based on that. So there's more information to come. We're really working on developing a job aid that you can take with you to help quickly calculate savings for something. So for example, Medicare Savings Program, Medicaid programs, Medigap programs, all of that. So that's in progress, and stay tuned for that. Also, you know, this idea of savings is something that has been talked about at the national level too. So it's something that there's a work group that's being formed, and we're trying to communicate together with that. And with that, I thank you so much. If you have any questions about any of today's content, please let your site coordinator or myself know. And I hope that you have a wonderful start to the summer. Thank you so much.